one thing about the buzzers, once you buzz in, that's it, and it rings, don't keep hitting the buzzer, please, because it will drive us all crazy. Okay? So, try to buzz one at a time, okay? Okay. All right, so let's get started.
I'm shaking. I'm shaking.
Now, one more thing about the rules. If it's a numeric answer, just a single number, like let's say 25, you can give me the answer within plus or minus 10%. If the answer requires a range, you have to give the exact answer. That's because I can't figure out the 10% that quickly. Okay. First question. The category is administration. What is the correct number of team members for the academic challenge? Stony Brook.
4?
Correct. Okay. That was just a test. Where is the fourth member? All right. All right. First question. Pharmacology. What is the meter dose inhaler dosage for ipratropium?
2 parts to 19.
Correct. Acute care. Hypercapnic respiratory failure.
Increase in PaCO2.
I'm sorry, I didn't hear this.
Increase in PaCO2.
That's correct. Neonatal and pediatrics. What is it? Don't keep your hand on the mic because that's what's supposed to be done, okay? What is another name for hyaline membrane disease?
Chronic lung disease?
That is not correct. Bmcc.
Can we get a question?
What is another name for hyaline membrane disease?
Respiratory distress syndrome?
That is correct. The category is gas therapy. Under normal circumstances, what is the atmospheric concentration of CO2?
0.03%?
That is correct. Gas therapy. What does the T to F ratio measure? Gas therapy for Bmcc. What does the P to F ratio measure?
The ratio of the PaO2 over the FiO2.
That is correct. Anatomy and physiology. The diaphragm is innervated by which nerve? Bmcc.
Phrenic nerve.
That is correct. Mechanical ventilation. What is a time constant? Stony Brook.
Time.
Bmcc. Would you like me to reread? What is a time constant?
The amount of time it takes a lung unit to empty.
That is not correct. Pulmonary function. What gas is used to perform a V? Stony Brook.
For carbon monoxide?
That is not correct. Bmcc.
Can we get a question, please?
What gas is used to perform a ventilation scan?
Time.
Okay, back on the clock. Neonatal and pediatrics. What is the name of the thick?
Meconium.
Meconium?
That is correct. I told you you went to Bmcc, right? Pathology. What is the term that refers to inflammation of the lung parenchyma? Stony Brook.
Pleuritis? Pleuritis?
That is not correct. Pathology. What is the term that refers to inflammation of the lung parenchyma associated with alveolar filling by exudates?
ARDS?
That is not correct. Humidity. Is an HME a passive or active Stony Brook?
Passive?
That is correct. Gas therapy. How does a galvanic oxygen analyzer work? Stony Brook.
Electrochemical.
That is correct. Pharmacology. What enzyme rapidly metabolizes acetylcholine?
Bmcc.
Monoaminoxidase.
That is not correct. Pharmacology. What's that? Oh, you want to answer that question? Sorry. You don't want to answer? Pharmacology. Which drug is a proteolytic?
Guanase alpha.
That is correct. Mechanical ventilation. What is the target PaCO2 when hyperventilating a patient with traumatic brain injury? Bmcc.
Below 35.
That is not correct. Stony Brook.
25 millimeters of mercury.
That is not correct. Okay. I was looking for a range, just so you know. Anatomy and physiology. How many cartilaginous rings support the trachea? The adult trachea. Bmcc.
16 to 20.
That is correct. Acute care. Define cyanosis. Stony Brook.
Decreased oxygen in tissues.
That is not the answer we're looking for. Bmcc. Define cyanosis.
Bluish tints to the mucous membranes when there is greater than 5 grams of desaturated hemoglobin.
That is correct. Wrong answer. Chemistry. The difference between the low water content of inspired air and the saturated condition.
Humidity deficit.
That is correct. Humidity and aerosol. Again, what is the most common nebulizer used? Stony Brook.
Jet nebulizer.
That is correct. Pharmacology. What is the process that inhibits blood from clotting? Stony Brook.
Anticoagulation.
That is correct. Anatomy and physiology. What arteries supply oxygenated blood? Bmcc.
The bronchial. The bronchial.
That is correct.
Good job.
Beta 2 adrenergic.
Exhalation.
Wasn't even your question, but that's good. All right, that is correct. Humidity and aerosol. That was, well, you didn't hear the whole question, so you don't know what the answer was. They did. Humidity and aerosol. What size aerosol particles are deposited in the lung parenchyma? Bmcc.
1 to 3 micrometers.
That is correct. Management. What is evidence-based medicine? Stony Brook.
Medicine that has had research done to prove its effectiveness and quality.
2 minutes. 2 minutes.
2-minute warning. Two-minute warning. As you can see, we're pretty close right now, right? We are. You don't want to know, okay. Everyone else knows. The judge is saying no. Throw the question out? It's the same thing. Microbiology. What is the definition of croup? Stony Brook.
It's the upper respiratory infection of the subepiglottic area.
One more time. You didn't have any for the judges. We need a time limit for the judges as well, right? It is 60 seconds, I'm informed. All right, while they're deciding on this, here's another question for you. Why do fluorescent lights hum? Why do fluorescent lights hum? Because they don't know how to sing. Yes, the answer is yes to that. Anatomy and physiology. What is the physiological process that raises the
Respiratory acidosis.
That is correct. Anatomy and physiology. Between the thyroid and cricoid cartilages of Stony Brook. Bmcc, yes.
Cricothyroid membrane.
That is correct. Anatomy and physiology. What is the ability of myocardial? Stony Brook.
Automaticity.
That is not correct. What is the ability of myocardial tissue to spread or radiate electrical impulses called?
Excitability.
That is not correct. Next question. Acute care. What are the two measurements most often used to assess respiratory muscle function?
Maximum respiratory pressure and forced vital capacity.
That is not correct. Bmcc. Well, that's different. Okay. Acute care. Once again, for Bmcc. What are the two measurements most often used to assess respiratory muscle function in patients with neuromuscular disease?
Maximal inspiratory pressure and vital capacity.
That is correct. The passing Muir valve allows the patient to... Did they listen before? Okay.
Speaking now, the less them speak.
That's not the answer. It's a good answer, but it's not the answer to this question. Okay, so round one goes to Stony Brook.
Got this, Mr. Got this. Come on, let's go. Let's go, let's go.